Hello, everyone. This is Jennifer Salazar from the Better Business Bureau Education Foundation in Houston, Texas. Thank you for tuning in to this week's Scam of the Week. The Better Business Bureau Education Foundation Scam of the Week for September 7th, 2020 is contact tracing scams concerning COVID-19, also known as the coronavirus. The information presented in this week's Scam of the Week is from our Senior Medicare Patrol. The Houston Better Business Bureau Education Foundation has a Senior Medicare Patrol for the whole great state of Texas, all 254 counties. Before we discuss the scams concerning contact tracing, I wanted to share with you all the Senior Medicare Patrol and what exactly we do and how we can help you in your community. We are federally funded. There's one in every single state in the United States. In fact, we're even in Guam, Puerto Rico, the Virgin Islands, and Washington, D.C. This makes up a total of 54 Senior Medicare Patrols. We recruit and train volunteers and professionals about Medicare fraud and abuse. Currently in our great state of Texas, we have volunteers that help us do presentations, that talk to individuals one-on-one about fraud, error, and abuse and how to prevent it. And we try to stop it before it happens. But unfortunately, if it does happen, we kind of build a case and we report that to the Medicare control units. We never investigate a case, we turn them in. So we just take down a lot of information and we get it to the appropriate Medicare control units. We have a special mission at the Senior Medicare Patrol. We're also known as the SMP. Our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to protect, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. And later in this presentation today, we're going to discuss more of protect, detect, and report because those three easy words will save you every single time. Now let's turn our attention to contact tracing. So contact tracing is the key to slowing the spread of the coronavirus and helps protect you, your family, and your community by letting people know they may have been exposed to this virus and should monitor their health for signs and symptoms of COVID-19. Helping people who may have been exposed to COVID-19 get tested. And asking people to self-isolate or self-quarantine to reduce the risk of spreading COVID-19 infections to others. Let's discuss what contact tracers will do. They will be state or local Department of Health employees or other contractors. They will ask about your personal symptoms to gauge for possible COVID-19 infection. They will ask about others you may have come into contact with recently. They may be able to refer you to other medical and social resources. They will ask whether you have insurance so they can connect those who are not insured to the appropriate resources. But you need to be cautious. You need to be cautious to make sure this person's legitimate. So you need to watch out for anyone that does the following. Ask for specifics about your health insurance, like what is your Medicare number? Claims they need a credit card or cash to pay for a coronavirus test. Want your personal information to help you set up a COVID-19 test. I wanted to share with you all this wonderful flyer from the Federal Trade Commission. And to get more information on coronavirus scams, you can always go to their website at ftc.gov. We've already discussed most of these, but I wanted to go over them one more time. Again, real contact tracers won't ask for your money. They won't ask for your bank account or your credit card information. They'll never ask for your Social Security number or your Medicare number. And you shouldn't be afraid because they'll never ask for your immigration status. They don't want to know. They just want to stop coronavirus. Do not click on a link or a text or an email even from a contact tracer because you might download malware, which is a virus, onto your computer. Contact tracers will not contact you in any of those forms. Talking to a real contact tracer can stop the spread of coronavirus. And if you believe that you are talking to a fake contact tracer, contact your state or ftc.gov/complaint. And the reason why I tell you all don't give your Medicare number out to anyone calling on your telephone or coming to your door is because a Medicare number is easily worth $30,000. So let's discuss this a little bit further. If you receive a phone call saying this is Medicare, or we need your Medicare number for a coronavirus test, or a knee brace, or a back brace, don't do it. Medicare will never, ever, ever call you on the telephone or come to your home. We're going to talk about those three special words again: protect, detect, and report. And you can always report any of this and any phone calls you get from people pretending to be Medicare to your Texas Senior Medicare Patrol at 1-888-341-6187. And I always tell people, you'll get a call from the Queen of England before you get a call from Medicare, because it's not going to happen. Medicare's not going to call you. Let's go over my three favorite words: protect, detect, and report. Step 1, protect. I want you to do the following. I want you to treat your Medicare card and number like a credit card, because it's easily worth $30,000. But not just that. If somebody is using your Medicare card and you need a service someday, you could be denied if it was already charged. I want you to know that Medicare will never, ever, ever call you on the telephone or visit you to sell you anything, ever. I want you to be cautious of free offers. There's no such thing in life that is free but your mama's loving. And guess what? That Medicare number is worth a lot of money, and they might send you free stuff, but somebody's going to pay for it. Last year, $60 billion was lost in Medicare fraud, error, and abuse, and that was what was reported, because not everybody reports Medicare fraud. I want you to watch out for identity theft. I want you to check those Medicare summary notices. I want you to look at your credit card and your bank account information. I want you to check your mail. If you're getting things in the mail that you didn't apply for or doesn't look familiar, I want you to contact us. I want you to pass this information on, because the only way to stop fraud is to talk about it. I don't want you to do the following. I don't want you to give out that Medicare number except to your doctor or other Medicare provider. And I don't want you to carry your Medicare card unless you need it. Because what if you're out shopping and you lose your wallet? You just lost your Medicare card. Only take it when you need it. Step 2, I want you to be a detective. I want you to detect. I want you to review your Medicare summary notices or other statements. For example, if you're on a Medicare Advantage plan, you get what's called an explanation of benefit. I want you to check that as well. I want you to look for services that you did not receive. I want you to look for double billing. And I want you to look for services that was not ordered by your doctor. Also, if you don't want to wait every quarter to get your Medicare summary notices in the mail, you can easily access your Medicare information at www.mymedicare.gov, and you can review your Medicare statements on there. And I also want you to use a personal healthcare journal. I have a picture of a healthcare journal on your screen. The Senior Medicare Patrol can provide you with a healthcare journal. Just give us a call and we'll collect your address, and we will go ahead and mail you that. And step 3, this is the hardest step for most folks. If you believe that you have been a victim of Medicare fraud, error, or abuse, we want you to call your provider to discuss what's going on, if it is a possible error, and maybe to resolve it. I want you to gather your information and documentation, and I want you to contact the Texas Senior Medicare Patrol. Again, our telephone number is 1-888-341-6187. And always remember, it is free and confidential. You matter to us. We will never breach your information. We are there to help you. We don't judge you. If you give out your Medicare number, we're there to help you. Thank you all so much again for joining me for Scam of the Week. My name is Jennifer Salazar. I'm the Program Director of the Texas Senior Medicare Patrol, and I'm with the Better Business Bureau Education Foundation. To reach us, again, our hotline is 888-341-6187. 713-617-6187. If you need to contact me directly, my number is 713-341-6184, and my direct email is jsalazar@bbbhou.org. Thank you and stay safe.